8:30, and being who I am, I like to start promptly and reward those that get here on time, and the others can catch up. So, happy Friday morning. It's really nice that the sun is shining, and even better that all of you have joined us this morning. Um, oh, we've got our little message is gone now. I was going to make a comment about it, but I will move forward. So again, thank you everybody for joining us. I want to just recognize that we've got Chair John Henry with us this morning. We've got Councillor Mark Zwart, Councillor Ron Hooper, and Cynthia Davis, President and CEO of Lakeridge Health. Thank you for joining us. I know that days are busy right now for all of you, and we appreciate your time and continued support in our initiatives. Um, of course, we also have Mayor Adrian Foster with us this morning. I don't think we need to do a formal introduction. We all know Adrian in great depth because he's an incredible supporter of the business community and is here for us all the time. So we appreciate your continued support, Mayor Foster. With that, I am going to ask Tanya to uh, put the little meme back up on the screen and hand it over to Mayor Foster. This was a little riddle that he is planted for us all for some, I'm going to say it, food for thought.
Sheila, I am here too. I know
Welcome,
I am Angela today.
Welcome, Granville. I'm glad you're with us. Thank you. So with that, I will hand it over to Mayor Foster.
Well, good morning, and you can take the meme down. I'm not sure how much of a riddle that is. More a really horrible sense of humor. For those of you who who follow my personal Facebook page, we are trying to share smiles, trying to find something to laugh about. But when I do these, you will know when I normally do a speech. There is a point. Councillor Hooper is absolutely correct. There usually is a point to all of these. Sheila's asked me to go for 15 or 20 minutes. I've got some questions and some feedback to ask of you at some point. And I have a very long list of things to bring to you. So I'm going to go very quickly. Normally when I do, an address, we've got PowerPoint presentations and whatnot on there. Something that has come out of the pandemic is, I think one of the worst things at meetings is when someone does a PowerPoint presentation and reads it to you while you're staring at the screen. And the other is, very sadly, our opportunity to see each other is now on a computer screen. So I didn't want to do the presentation and take away that small opportunity. And then bandwidth is problematic. So most of you probably have to turn off your video. So I'm going to do a really quick overview of what's gone on in Clarington in the past year. Give a sense, and when I say quick, boy, do I mean quick. I'm going to go back to about a year ago today, a little bit further, when the shutdown with the pandemic hit. We were probably running 12 and 14-hour days scrambling, trying to figure out how we were going to pivot, how we were going to manage the pandemic and just continue operations as we could, figuring out what we could do, couldn't do, would do, and wouldn't do. I would suggest that within about 2 weeks' time, we found our stride. And I actually found myself, because suddenly there weren't gala events on the weekends, evening meetings, committee groups, not our meetings, but those were gone. There were a couple of meetings that the region didn't hold. So suddenly myself and the councillors found ourselves with evenings and weekends free. And it was, oh boy, look at this. We've got all kinds of time. And things changed very radically on that. So as much as we thought that things might be quiet, and I speak to an awful lot of people who are expressing how quiet things may be, if you overlay what's happened in the past year, so you may or may not be aware that Clarington, at exactly the time the pandemic hit, we went through a significant reorganization. So a couple of departments have been absorbed into other departments. Some department heads have portfolios that they never had before. We have a couple fewer department heads, and as that might imply, we had a number of retirements. So a significant change in the executive team. And if any of you in your organizations have been through significant organizational shift, you know how busy that makes things. Then at the same time, we had, and everyone is aware of this, an absolute boom in building applications, and not just residential, but also if you look at what's going on in terms of commercial. OPG's head office coming here. I'll speak a little bit later to how you can help us on the GO train. The Canadian headquarters for East Penn, and I could go on. We had that going, so I may be wrong, but this is the busiest or one of the busiest years that we have had, aside from all of that. And then you would want to layer on the pandemic, where we had to pivot very quickly to digital meetings, very quickly with staff working remotely. So if you think the challenges of that, and that has worked out exceptionally well. And I've got to give kudos to staff that they didn't skip a beat. So again, in all of your businesses, if you're thinking of the challenges that the pandemic put on, screening people as they're coming in, needing appointments, all of the PPE, it has been an exceptionally busy year. And then there are a couple of major files that Clarington has a significant role in. If we're looking at the nuclear file, and on the nuclear file, again, I'm going to try to squeeze this in a little bit. We've got, up and coming, there is a new medical isotope group that is being formed. As you know, the headquarters are coming. We've got the refurb on the second reactor moving forward, and we've got the small modular reactor. So already a significant presence in Clarington, will be a greater presence. So you layer that all together and you will get a sense of how busy we have been and how busy staff have been. So I'm going to do a slight diversion here, and sorry, Ryan, you didn't know that I was going to do this, but we do, as I had noted, we do have some new members on our executive team. Ryan, can you put your video on? So you'll see Ryan Windle there, and Ryan is our new director of planning. And it's not planning anymore. I'm sorry. It's gonna, old habits die hard. But I would say the newest addition to the team, I think you will find that Ryan is incredibly approachable, and more than happy to, he's learning in depth about the municipality now, and more than happy to speak with you. Aren't we glad I made that commitment on your behalf, Ryan? But Ryan, we're pleased to have you here. And if you want to say hello to everyone, go for
it. Thank you, Mayor Foster. Yes, I'm Ryan Windle. I'm the new Director of Planning and Development, and I think I've met some of you already. I see some familiar names and faces, and I'm certainly excited about my role here and helping Clarington move forward over the next number of years. And I do appreciate the characterization of being approachable, Adrian. And I certainly would say if anyone wanted to speak to me or meet me, certainly send me an email or give me a call, and I'll try and help out.
So, Ryan, this is public, so I have to say nice things about you.
Thank you.
So again, because of the pandemic, people haven't had the opportunity to meet some of the staff. So the hidden message, again, if you go to my personal Facebook page or the mayor's Facebook page, I'm not as active on that. It has become brutally apparent that people want a laugh, they want to share smiles. When I post things about where you can get a vaccination, the more serious stuff, I will find that 3 or 4 or 5 people have paid attention. I can tell you, I posted a picture of my car and I had 90 likes and comments. I don't get it, but we're tired. There is fatigue because of the pandemic coming in. We're certainly seeing that, in the comments as you're going into stores. If you come into the municipal building, you're seeing signs saying that there is a zero tolerance, level for rude people. I can tell you, one of my colleagues that I know really well, 17-year-old daughter just started her job, second day on the job, had adults dropping the F-bomb because they were frustrated they couldn't hear. And we really, really, really need to pay attention to how serious the pandemic is. So as much as I had superficial injuries on that because someone threw a bottle of omega-3 at me, we need to worry. There is an important message in there, and the important message is how serious this third wave of the pandemic is. I know that people aren't listening to me. They are tired of that to a degree, the province and the news. But if we look at how desperately our healthcare is struggling, you don't want more than a superficial injury right now because of the limitation of ICU beds. And I'm not suggesting that you are going to be turned away from the hospital, but the numbers are quite dire. I would ask you to please, please, please reach deep within yourselves. Be smart with what you are doing in terms of following pandemic protocols. Our healthcare providers are doing everything that they can do to keep us healthy and alive. I would ask you to please help them and not hinder them in that. And with that, I'm again a little bit of an ambush. Someone that you probably haven't met is Cindy Davis. Cindy is the new CEO of Lakeridge Health. Cindy, can you just really briefly help people understand how dangerous it is right now? And as much as we are frustrated with masks, we are frustrated with protocols, we are frustrated with restrictions, but the stuff I'm reading suggests that we are at the most dangerous phase of this. And I hate to be negative, guys, but we've really got to get this under control in the next couple of weeks. Cindy, can you help me out with that?
Well, thank you, Adrian. And so we've been talking about this every opportunity we can these past couple of weeks, and both internally and externally, we say we understand people are tired. They're tired, they're fatigued after months and months of this pandemic. We are now in wave 3, but I just want to be clear, this is what we expected in wave 1, what we're seeing in wave 3. It is for us the most challenging thing our health system and Lakeridge Health has ever dealt with as an organization. We are seeing significant rises in the number of COVID patients that are presenting to hospital, the number of ICU patients. I can even say, Adrian, that I arrived to Lakeridge Health in January, and the numbers now are significantly increased since that time. I mean, we're talking about 67% increases of admissions to hospital, 50% increases to ICU associated with COVID patients. And what we've talked about is that we've reduced activity. We're down to emergency surgeries, time-sensitive surgeries for cancer. We have moved all of our pediatric admissions to sick kids. We have supported birthing for Port Perry to move to Oshawa. We've decanted mental health patients to Ontario shores. And with all of that, we are still facing the biggest challenge of our organization. So this morning before I joined this meeting, I heard about all of the plans that are in place in terms of how we can actually increase more ICU beds. And over the month of April, we've seen, high numbers of ICU admissions. But the other thing that we've seen is the support that's happened in the province to actually have people transferred to other ICU beds throughout the province. We've transported actually over 30 patients to Peterborough, to Kingston, to Ottawa, and that will continue in terms of how we're trying to make sure that we have beds available when people arrive at our doorsteps. We're looking at different models of care. We're looking at physicians today actually working as, an assistance within our critical care areas, doing direct physical care, what you would normally see nurses do. And all of this is to really protect our community, and so that when people arrive at the doorstep, that we can actually care for you and care for you in the most appropriate places that we can. The other thing is that what we're seeing is significantly different than in the other waves. People are younger, they're sicker, and when they arrive, they have more likelihood to be admitted to critical care. And so for our own staff, I say thank you. To our community, I say thank you. This has not been easy. It comes as a sacrifice for all of us. There's none of us that have been untouched by what's happened throughout this pandemic. But now more than ever, we need you to stay vigilant. The modeling for Ontario, for Durham region, tells us that the stay-at-home orders and the push for vaccination is the only way that our system is going to be able to cope and flatten the curve over the next several weeks to deal with this issue. We keep talking about there's light at the end of the tunnel. We believe it, but it's going to be a couple more weeks before we can actually see our way out of what our healthcare system is really facing. And again, I can't stress enough how significant it is. And to your community and to all the people that are joining us today, please, thank you, stay vigilant, and we appreciate all you're doing. So happy to take any questions
Cindy,
if people.
Well, so I think Cindy will. I'm going to move forward with a couple of things, and I don't want this to be a dire, gloomy. But at the end we'll move. And I didn't mean to put you on the spot, but it is important. I'm hearing that there might be another protest coming on Sunday, and I get the frustration. I get the fear. It is touching all of us. I get the financial impact, and the financial impact is touching many of us in ways that people don't get. But this is literally life and death, and I'm not sure we're getting that message out. So I'm gonna switch around, and Cindy, thank you if you take questions later. And I know that I've got a very limited amount of time. So on the limited amount of time, Sheila was asking me on the GoTrain file, what we can do, a hugely important file. We've heard about this for years and years. We ran into the bump in the road where the province was thinking that maybe south side of the 401 was a great idea. They came to the right decision, bringing it back to where the public were. There was a great plan using the bridge that GM uses. And then we had fantastic news that GM was reopening, which threw a wrench into those plans. We thought we had a path forward. The work is going on with that. We are getting monthly briefings at this point in time. I've got to thank Chair Henry for the way the region has stepped up. Oshawa and Clarington are still highly involved, but the region is involved to a degree that they never have been. And that is in large part because of John's leadership. But what can you do on that? You can continue to let our MPPs know how important that expansion is and how important it is that it happens in a timely basis. This is decades beyond where it should be. So we are hearing very positive things, but we can't let up on that file. So please send emails, letters if you're speaking with the MPPs in the area. Let them know that they can't take their foot off the gas on that. Speaking with OPG, OPG has always been a really interesting file. I think every address that I've done, I've brought them up. For those of you who don't know, OPG's headquarters are coming to Clarington down in the Energy Park. That is not new news. I don't know when they can share with you their plans for what the campus looks like. So we have seen drafts of that. It is exceptionally exciting. That'll bring about 1,000 new employees. These are, good, high-paying jobs to the area, which means that OPG will have well over 2,000 employees here. Beyond OPG coming here, we know that we are going to attract the businesses that support OPG. So there is a huge opportunity. I don't know how that moves into opportunities for you. I would encourage you to look up SMRs, or small modular reactors. So this is the future of nuclear across the globe. Some of the technologies are really interesting technologies. It's sort of a matter of what is old is new again. So a lot of work was being done on small modular reactors. And if you hear about ships that are nuclear powered, that's exactly what these are. This is not new, not unproven. But there was a choice in the 70s to go with huge, large power plants, and we're moving back from that. Darlington right now, has a license for nuclear new build. There are no specific plans on SMRs, but that site is being considered very closely for an SMR. We don't know what the technology looks like. CNSC, hasn't done any work on licensing company A, B, or C, but it is really, really interesting. And again, I would encourage you to look at that file and think of how you participate. Canada is incredibly well positioned on that. There is massive opportunity that exists here that doesn't exist in other spots. You may or may not know, with I think it's Unit 3 is the second unit that is being refurbished, the ability to generate medical isotopes, potentially a couple of different isotopes, is being built into that. Again, I don't know what the opportunity, and this is part of how you look at your businesses there, that you may or may not be aware that Canada produces about 50% of the isotopes that are used globally. And those isotopes are used both for therapy, if you've heard of nuclear medicine, as well as sterilization. So as we're worried about the pandemic, a lot of stuff, PPE that is being sterilized, medical equipment, globally, half of that is happening as a result of the Canadian nuclear industry. So maybe if there's an angle for you, check out the Canadian Isotope Council. That is fairly new, and they will be expanding. And consider with CNSC, we will be in front of the CNSC in a couple of months about the relicensing, to allow that, consider a letter coming in supporting that, huge opportunity for Clarington. I want to touch really briefly, and I know time is going by way too quickly here, on broadband. We keep waiting for announcements. I can tell you Clarington is in perhaps a different position than the rest of Durham region, where we have a number of internet providers that have applications into the province and federal government, and have plans to get shovels in the ground, I'm going to say tomorrow. So as soon as they get word on those applications, they are eager and ready to go. A significant portion of Clarington could be connected in a fairly short period of time being a couple of years. And I dance a little bit around this in that I had on my desk in December an announcement from one of the major providers in terms of what they were going to do, because they thought that they were getting confirmation on their funding. We didn't release that because we weren't comfortable until that was done. And this has taken many more weeks than we expected. That has happened so many times. But we are getting coverage. If you look at the major areas, that are now connected to fiber, there has been a huge increase in the areas where the ISPs can make money doing this. Huge uptake and huge build out in Curtis, Bowmanville, and Newcastle and other areas. So keep an eye on that. A report that is coming by very shortly is one that council had asked to be done on the development of economic development services. So the Board of Trade does that for us. I would ask you to please look at that report. I haven't seen it. So as things go, staff prepare reports outside of any political interference on that. Please take a look at that report. And please provide feedback on that report. Andy, when do you expect that to come? Andy didn't know I was going to ask that question. So this is Andy Allison, for those of you who don't know, is our CAO. So when should people look for that hitting an agenda?
That report will come to the last general government meeting in May. And I'm sorry, I don't know the exact date off the top of my head.
So we will, Sheila, we'll get a link to that. And Sheila, you may want to push that out to your members. But the whole point of economic development beyond attracting new business to town, it's how do we help you? So it's the retention and expansion part as well, and you have a direct interest in that. So I'll ask you please to help with that. So with that, this is where I'm going to sort of turn things over depending on the time that we've got. And I'm sorry, we've squeezed a whole lot in. So consistently, I've been holding meetings with the MPPs and the MPs with the BIAs over the past year. We are looking for the ways that we can most effectively help you with this. People are struggling with that. Some suggestions, and this comes with Sheila, if there are changes to specific changes to federal or provincial programs that we can make that are perhaps easy changes, we're happy to advocate. We have been both locally here at the region. I'm part of the Ontario Big City Mayors Group, which represents about 70% of the population of Ontario. We have been advocating, on businesses' behalf where it makes sense and where we can. I can tell you that we do not have a seat at the table, and in part for really good reasons. We are not privy to the information that the province has in terms of making decisions. We don't have all of the facts. We don't have the expertise, but we are, again, where we're suggesting it makes sense for the province to consider making changes to one thing or another. We're asking that. I'll use ski hills as an example. I don't have details on how dangerous COVID is on a ski hill. Seems to me that this would be a low risk activity, and we did advocate for changes. I can't recall what the big city mayor's position was on that. We have advocated for the paid sick leave. So, is there a way of getting money in people's pockets that need this? And we do seem, and I'm saying seem because I don't have the data to see where in the Amazon warehouses and whatnot, that this is really problematic. But we are looking for ways, tell me please what your business needs in terms of help. I've got all kinds of ideas, but they are your businesses. And I know that the Board of Trade has done a number of surveys. They've been reaching out, the BIAs as well. Councillor Hooper is hugely involved in the Ontario Business Improvement Association of Ontario, right across Ontario. So, we're here to help how we can with that. And I'm going to shut up because Sheila, you had a couple of questions, and I know that we are already at 9 o'clock, and I don't want to keep anyone any longer. So I apologize for going a bit further. I think it was really important to hear from Cindy, and I think Cindy's willing to take questions if we have time. So Sheila, I'm flipping this over to you.
All right. Well, thank you, Adrian. And thank you, Cindy and Ryan, for jumping in at the last minute there. You always know you're getting sincere conversation, right? When people aren't expecting to speak. So I will say it's certainly encouraging to see that major projects and interest in development. I know our office is seeing a steady flow of interest for investment, similar to what we have in the past. So it's all a matter of us being ready when the switch gets pulled and they say we can go back to normal, which I know we're all looking forward to. So Mayor Foster, we really appreciate your insight this morning. We're going to do something a little fun this morning. We're going to try something a little fun. This is new for us, so be patient with us. We're going to try and do, we've got 3 or 4 questions that we're going to do a live poll on. So everybody on the call gets to participate. So Tanya is going to put some questions up on the screen. Can everybody see those? So we'll do them one question at a time, and the results should pop up in the side panel on your screen as they come in. So our first question is, what do you feel your business recovery timeframe is once we are in full post-pandemic state? Do you feel like your recovery would be less than 1 year, 1 to 5 years, more than 5 years, or you may not recover? So if you can fill that in. And what we're going to do with the results of this poll is take it away and look at how we can develop programming. You know, our goal at the Board of Trade is to help us all get through today, but also be prepared for tomorrow. So this will be really helpful for us. So if everybody can fill that in. And I'm not seeing results pop up. So I guess, like I said, this is new to us, so be patient.
Sheila, I'll be able to share the results at the very end once all the questions are done.
Okay, so question 2, then we'll just kind of rifle through them here. Question 2, would your business be interested in participating in a workplace vaccine rollout program if something was available through the province of Ontario or a local public health unit? Yes or no? The silence, right? That moment of silence. Third question is, which of the following municipal support initiatives would be most valuable for your business? Financial and programming recovery like CIPs, increased communication, or customer service? I'm sure some of you want to click a couple of those off, or all of them, but we're only letting you pick one today. So question 4 is, do you plan to, or have you already applied for the Community Improvement Plan CIP grant that the municipality implemented earlier in the year, or maybe it was later last year? So your first options are yes or no. And then if no, there's 4 options here for you to choose why you haven't or why you will not be applying for that CIP. That you missed the deadline, the application process was too complex, uncomfortable with sharing financial information, or you did not qualify. So while Tanya's tabulating all of those results, I hope everybody enjoyed that little bit of engagement. It's hard to get engagement, so we're looking for new ways for interactive play at the Board of Trade. So I'm going to suggest that we have some time. If anybody has any questions, if you want to put them in the chat, that's our easiest way to monitor, because I can't see all the participants at once. So I know we did have a question, Adrian, that had come in advance, and it was surrounding, I'm going to paraphrase this question a little bit. It was surrounding timing for the servicing of the employment lands in the technology park at in the Bennett Road area, and focused on that recovery piece and us being ready when the economy does reopen, and we're ready to start realizing some of these opportunities that are knocking on our door. Is there a way for us to accelerate the technology park to be able to realize some of that investment opportunity?
So I'm guessing that might have been Jay Strasser, and Jay, it is, I haven't seen you in a while on that. The region is moving forward now. That was identified in a report coming from the region and getting servicing out there. I'd suggest they're moving about as fast as they can, but again, and Chair Henry is on here. He and I know John appreciates how important this is. It's going to be a matter of keeping our foot on the gas pedal, making sure that at the region that funds are set aside to get that servicing in the ground. Again, a change at Durham Region, if you looked at how the region is operating today versus 3 years ago, there was a huge set of obstacles to servicing lands. There was the attitude at the time that if you use taxpayer monies to service lands, you were benefiting private property owners, and that was inappropriate. On servicing stuff in advance, we get that money back. We allow property owners to develop, to create jobs, to move things forward. So I would suggest that there has been a 180-degree turn. The willingness for the region to get out, and we are servicing properties now and getting a plan in place in terms of how we are servicing. So Jay, if that was you, and if it wasn't you, reach out to me. I will pass that along, and to anyone. Please reach out. You know that there's an open door policy, but it is on the radar. It is on the report, but we don't have a specific time. I can't tell you exactly when that is happening. I'm guessing, and John, I don't want to put you on the spot, but my recollection was we expected something more tangible to come on a couple of the Clarington projects with the next budget. Yes, I've got a brutal memory. We'll leave John alone.
John,
Adrian.
John is not on miking.
Adrian, it's Andy here. We actually put in a report that we took to our council, the estimated or where things are at with that project, and the region is funding the detailed design work, and they are moving forward as quickly as they can, as you said. So if anybody needs specific details, I can also refer them to some of our internal reports on where things are at with that servicing.
Don't you love the way Andy comes to rescue me when I need rescuing? Sheila does too, by the way, just so you all know.
Sometimes. Sometimes. So Tanya, do we have any of the results ready, or? Oh, here we go. So that's encouraging. Look at that for our first question from a time frame of recovery, less than 1 year. So that's exciting. So what that tells me at the Board of Trade level is that we need to be ready, right? We need to be preparing now for when they open that gate and let us go. So so that's super encouraging. And for those that are in the 1 to 5 years, let's spark a conversation on what we can do to help you prepare so that we can accelerate that recovery time maybe a little bit.
So might I jump in? I see on the communications piece, could you poll the members or get information in terms of what kind of information? As I noted earlier, when we put serious stuff out regarding the pandemic, my impression is there is very little interest, and I could be wrong. But if we could get a sense of what you need to hear from me, council, staff, all of the above, please let us know specifically, and we'll be happy to do that.
Yeah. And I think to that point, Adrian, right? I think it's, it's the word we continue to hear and use right now through this pandemic is collaboration and how we're all in this together. And so I think that that as long as we're sharing information with one another, right? If we're all sharing that same message, then somebody's going to read it through one of the platforms. So let's continue that partnership for sure. So the second question about a vaccine rollout, sorry, this was a bit of a cheeky question. I don't want people to walk away thinking that I have some insight that this type of program is coming down the pipe, but we have had several phone calls in our office for those that have access to the health table. That our businesses are interested in being a part of the solution and want to make sure that they have healthy sites, workplaces. So we're here. If there's a mechanism for us to help, we're here. That was the intent of that question for us. So increased communication. So we talked a little bit about that. And then for the CIP question, oh, isn't that interesting that most didn't qualify for the CIP grant. So maybe that's something we'll take away, Ryan, to the planning group and take a look at how we might be able to tweak that. So for those that said they didn't qualify, if you want to shoot us an email and let us know which part of it disqualified you off the top, that would be great. And we can start addressing that. So thank you for participating in our poll. We're hoping to continue doing this and gathering your insight and your feedback on how we can better create programming for you and how we can better build those alliances and communication paths between all the stakeholders. Building a community takes all of us, doesn't it? So Tanya, if you want to take that off the screen, that would be great. So I don't see any other questions in the chat, which means that Mayor Foster must have done a bang up job.
Sheila, it's Jeff Goldman.
Hi, Jeff.
Hi. It may be my technological lack of prowess, but it appears to me that the chat function might not be on. So I don't know if that's just me or others, but while I'm here, I will take the opportunity. First of all, to thank Mayor Foster for his time this morning, and also to pass on my compliments to staff and council in really keeping the ball going. I mean, it would have been so understandable if there had been significant delays, and I'm talking mostly from the realm of development applications and processing, and things have continued on with diligent efforts, and I appreciate that greatly. And to the mayor's point about the importance of keeping the foot on the gas with regards to the GO stations and the expansion of GO service. We know that part of that mix involves having the population to support the business case forego, and that council has been aware of that. And in terms of examining various, in particular, secondary plan applications that have been before it, which will, with their approval, allow for substantial residential and employment lands development that will support the GO expansion. We appreciate that. There are 2 secondary plans, I understand, that are coming before council for approval next month. I encourage all members of council on this call to give them every consideration for moving forward for the benefit of the community. And also, to that point, we know that there's a domino effect with so many of these growth issues, and some of that, again, has to do with services and infrastructure. If we're going to have the growth, we have to have the pipes and the roads and all that. And particularly in Bowmanville, with the pending approval of the Brookhill application on the west side, the amount of growth that is hoped to come from that, and the need for the improvement, particularly of the intersection of Highway 2 and Bowmanville Avenue, which I know is on the books for the region to be undertaking. But the sooner that happens, it's already an intersection that has a lot of stacked traffic. It's going to be the main artery to the GO station, and the sooner the planned improvements for that can happen, the better. But once again, very encouraged by the response of this municipality to the pandemic, and we look forward to continued collaboration.
Thanks, Jeff.
Sheila, it's Bob Verway. The chat is definitely not working.
Okay.
For the mayor and John Henry both, the Canadian-U.S. border for us is a major problem. Getting our product across, we normally would have 200 pieces to sell. We have 30. The transport companies are frustrated with the border, so they're just transporting south instead. I have so many clients that are aviation that worked for WestJet, Air Canada. You know, this border closure, people coming home, having to stay in a hotel from the USA. You know, I get it from Europe, and you know, thank God the federal government closed down the border from India, and they should do it from Brazil too. They're just taking too long. But you know, it's more effective to come to Canada now than it is to the USA. We desperately need this border open between the two of us in order for us to survive. Somehow it's just not getting through to these people. You know, our partners south. We just need this open and stop penalizing. You know, the American pilots are busy flying into Buffalo, and the Canadian pilots can't fly into Toronto. Doesn't make sense. Can you steer me here, John Henry or Adrian, or maybe Rob Ford seems to be lost a little bit. So can you help out here?
So Bob, I'll jump in, and to a degree, both John and I, and John, please, I don't mean to cut you off. To a very strong degree, I'm going to describe John and I as armchair quarterbacks, and John may have a different opinion on that. I was looking at a recent study where they had identified the variants coming in. Again, I'm speaking science. I'm not a doctor. I'm not a scientist. I'm simply regurgitating, and I don't have the information that the province or the federal government has in front of them. But the majority, based on what I was reading of the variants coming through, came from the US. Now we're seeing, because of vaccination, their rates go down. And I know we are frustrated with the federal government and the provincial government. I feel, a degree of sympathy that the premier is under intense pressure to open up and not shut business down. And he's under the same intense pressure from the science table and doctors saying, you didn't shut enough down. If you had taken more stringent measures earlier on, we wouldn't be where we are today. And he really is between a rock and a hard place on this. So, in terms of me making a meaningful comment, I don't have the expertise, don't have the information. And I do not envy him. Don't agree with everything that the government has done provincially or federally. But I don't have the information that they are basing things on. We are quite happy again to bring it up. So Bob, if you want to get something to us, if there's a broader organization that is more helpful than one business, with some background, we're happy to bring it up in discussion and dialogue, because the chair is bringing the mayors together on a regular basis. I know he's speaking to the ministers. We're all speaking with the MPPs on a regular basis. And I'll shut up. John, I don't know if you want to jump in.
So I apologize. I had to take a call during related to one of our vaccine centers. So I haven't been on the call. I've been here, but I haven't been to hear any of the questions that were directed to me other than this one. So I apologize. And Bob, I absolutely agree with you. We'll raise the issue again if you just send us a note. I'll bring it up at the meeting that we have on Monday with the chairs and mayors of the 11 of us that meet around Lake Ontario on a Monday, every Monday at noon. But the frustration and the challenges we've had, we are in a world where the federal government provides vaccines, delivers them to the province, and our team has to do the delivery, and yet we can't get enough vaccines to meet the needs of our residents within the region, and that has been a challenge. And I understand the challenges related to business as well. So we'd be happy to raise those issues. We've each of the 8 municipalities in Durham have all declared emergencies. The regions declared emergency. The provinces declared an emergency. One of the questions I've been continuing to raise is why hasn't the federal government raised this as a declared an emergency to deal with this? So Bob, send me what you have, and we'll advocate, or anyone that is having challenges that you need some help with. Please send your emails to the mayor and myself, and we'll get it to the appropriate level of government for you and make sure that your voice is heard. Sheila, if they come in, send them to both of us, and we'll do our best to make sure that the province and the federal government hear.
Thank you.
Excellent. Well, it looks like the chat is now working. So I don't see any further questions, and we're just about on time now. So I just want to say, if anybody did have a question that they didn't get a chance to ask in the chat, please just send it off to us and we'll make sure it gets to the appropriate person.
So Sheila, can I end with an observation, a great business opportunity?
Yes, you can.
So, as I was going out the door this morning, my next door neighbor, said, good morning. And I was in here a smidge earlier to prep a wee bit for this. And I looked at him and I said, well, same time, just a different computer screen. And it made me think my son has a turtle, and he buys these pull off, stick on vinyl things to give the turtle a different view, so one's ocean, one's seaweed. And it occurred to me that for us, all of these Zoom meetings, we need something to put around our computer screens, so that our tanks, we've got a slightly different view, we feel like we are actually getting out. So, I'm thinking something that you stick behind your computer screen and change a little bit. Just for that, Councillor Hooper was asking if we had actually ever gotten off of a Zoom meeting. So great business opportunity for someone out there. I will change the view out of my aquarium into a world that may not exist.
There you go. I'm sure there will be many opportunities that come from this. And that being said, I want to again express our gratitude for everybody joining us this morning. It's us together that are going to get through all of this. I know it's frustrating. I know that we don't all agree with all the decisions that are being made all the time, and sometimes the the speed at which things are changing can be frustrating and difficult for us all. But we do have some level of control ourselves, right? It's up to us to keep our workplaces safe, to keep our employees safe. And that's something that we can all do to help those that are on the front line, working in our hospitals. And I think we need to keep that lens front and foremost, the impact on our healthcare system. And as a personal request, I have many family members in the healthcare system, and they're tired. So let's do what we can from our desks to make it easier, safer for our people to get vaccinated, and to help in the rollout and to help in the community safety the best that we can. That's my lecture for this morning. My staff will be happy because now I've lectured somebody. I don't need to do that again today. It certainly is encouraging, and it's as always such a blessing to work with this business community. We appreciate your collaborative efforts. The link for the survey for the economic development delivery review is in the chat. I believe we have emailed it out. If you don't have it, just give us a call or shoot us an email. We'll make sure that you have a copy of it. And it's important to do these reviews. It's important to look at what we're doing and look for opportunities for improvement and enhancement. So we encourage everybody to fill that survey out. And remember kindness. That's my last thought for the day. Remember kindness. That never goes away. So thank you again, everybody. And Cindy, if you can send our gratitude to everybody working in the Lake Ridge team. Thank you. Have a great day, everybody.
Thank you, Sheila.